Waking up with a broken heart, it's not unusual after Valentine's Day.
But for people experiencing a tragic loss, the emotional pain can trigger a serious medical condition. Here to explain is Dr. Ahmed Tawakkol, a cardiologist at Mass General Hospital. Doctor, thank you so much for making time for us this morning.
Thank you. Good morning.
Well, you call it broken heart syndrome. What can you tell us about the symptoms?
Well, broken heart syndrome, or Takotsubo syndrome, is a heart failure syndrome that develops suddenly after a physically or emotionally stressful event. The classic triggers include extreme emotional stressors, such as the loss of a loved one. It can also be triggered by stress of a serious physical illness. The symptoms of broken heart syndrome include chest pain and shortness of breath. Patients can also have palpitations and dizziness, and in rare cases, broken heart syndrome can be deadly.
Patients exhibit trauma and deal with it differently, so is it hard to diagnose?
Well, first, people who develop chest pain or shortness of breath suddenly should call 911. Those symptoms can also be caused by a heart attack. However, in contrast to a heart attack, broken heart syndrome is not caused by blockages of the large coronary arteries. Another unusual feature of the syndrome is that the heart changes shape, with the tip of the heart sometimes ballooning outwards. The combination of these findings lead us to suspect the presence of broken heart syndrome. We can also say that people who develop broken heart syndrome appear to have more stress-sensitive brains, with activity in the amygdala being higher. And in those predisposed, the acute stress could trigger spasms of the heart microscopic vessels and lead to that malfunction of the heart, a brain-heart connection gone awry. The syndrome is more commonly seen in people with anxiety or depression, more often in women and those over age 50.
Well, it's so stressful to go through something so difficult. How do you treat this?
We use a combination of medications that are used to treat the more common heart failure syndromes in most people, especially those with emotional triggers. The heart failure syndrome reverses itself. And then to reduce the risk of recurrences, we encourage stress reduction, more physical activity, healthy sleep, better diets, and more time with friends. These approaches make the brain more resilient to stress and support a healthier brain-heart connection.
Is it life-threatening?
It can be in rare cases, but more than often people go back to being themselves. The heart goes back to its usual shape and function.
Well, that's good news. Well, thank you for sharing that on this Valentine's Day weekend. Dr. Tawakkol with Mass General Hospital. Have a good rest of your day.
Thank you, you too.